how do we diagnose ADHD? It varies across providers. So, in a good assessment, we want to get a really clear picture of how the symptoms appear for this person. And there is no such thing as just a yes or no sort of answer when it comes to assessment. I come from a really strong research background. Michigan State is a clinical science program. So I worked in a research lab doing diagnostic interviews for 4 years. And while no can sometimes be a complete sentence, yes is never a complete answer. Yes is simply an invitation to probe further. So when we are assessing symptoms, we like to get as many details and as many examples as possible. Because, like I said, we're not dealing with objective brain scans, blood tests, genetic studies. We are really dealing with the minutia of people's subjective experiences. So the historical standard for, at least for psychological assessment of ADHD, has been a comprehensive neuropsychological battery. And so this would include things like, in addition to the clinical interview, a test of general cognitive functioning, or kind of in lay terms, an IQ test, a test of academic functioning. So seeing where people's skills fall in reading, writing, and mathematics. There would be tests of executive function. So executive function is anything that falls under the control of the frontal lobe. So things like planning, prioritizing, task initiation, sustained attention, the list goes on and on. There would also be tests for memory, in particular working memory. And then often there would be a continuous performance test, which is a computer-based test where a person is asked to do a very, very boring task, typically either watching dots or listening to a tone or identifying between like two categories for a long period of time. Usually 25 to 45 minutes. And the way that the computer provides the stimuli varies. So in theory, you are supposed to be able to pick up on a person's ability to sustain attention, their impulsivity, and the types of errors that they tend to make. And so for the longest time, this was kind of the gold standard for ADHD assessment. And it's still the gold standard in a lot of areas. So if somebody is applying for Social Security disability, if somebody is applying for accommodations at school or at work, if somebody is looking for accommodations on big tests, SATs, GRE, LSAT, whatever it might be, those boards still require this kind of testing. But in the past decade, this has actually become really controversial. So back in 2019, Russell Barkley, who is kind of a world-renowned expert in ADHD, published an opinion piece in his journal. And I'm going to read off the title because it's just brilliant. Neuropsychological testing is not useful in the diagnosis of ADHD. Stop it or prove it. And the entire idea in this piece that he wrote was that we do this comprehensive neuropsychological battery and say that this is necessary to diagnose ADHD. But research has shown time and time again that people with ADHD show greater variability than neurotypical people in task performance. So we wouldn't expect to see an ADHD pattern in testing. We would just expect there to be variability. But neurotypical people also show variability in testing. So we're not really teasing anything apart there. Also, he liked to talk about how there is just a difference in terms of doing this testing in a very controlled environment. So when we do neuropsychological testing, in school, we are instructed down to the tiniest little details. What are we going to put up on the wall so it's not distracting? What are we going to, what kind of noise machine, like what sort of sound machine do we have? What sort of things do we have in the room? If we test kids, do we keep the toys in a different room? Like this is a very sterile, atypical environment.
Time. How at Hello Mental Health have you tried to overcome these barriers? What does your assessment look like as opposed to this sort of neuropsych gold standard that just isn't practical?
Sure. So we do offer that if that is what a person needs. So, like I said, if somebody is applying for school accommodations, if somebody is applying for test accommodations, workplace accommodations, those institutions typically require this type of assessment, and we are able to provide that. But when we designed our assessment practice here, we set it up in a way that aligns with the research. So, being the clinical science nerd that I am, I went to the literature to look for best practices, but I largely used an article by Maggie Sibley, who is, again, an expert in ADHD. And she published an article about empirically informed guidelines for adult ADHD assessment. And that is what we do for most of our assessments here. So the first thing that we do before I ever meet with a person is we send out these initial screening measures. And screening measures have really good sensitivity. They're really good at picking up on if a symptom is there, but they also produce a lot of false positives. So you have a lot of people who will endorse symptoms that are consistent with ADHD, but they're experiencing it for different reasons. But it's a really good way for us to get started and for me to know what direction it might take when they come in for their first appointment. So when they come in for their first appointment, we do a clinical interview. So I get a lot of background information. I want to know about who they grew up with, what happened in their home, what school was like for them, kind of across the board, what their relationship was like with their peers, what their relationship were like with friends, if they're older, what their romantic relationships have been like. I want to know if there have been any medical conditions that can contribute to this. You know, we're finding, as research is starting to focus more on ADHD in women, we're finding that hormonal fluctuations can greatly impact the experience of ADHD symptoms. So I want to know if they're perimenopausal, if they've had their hormone levels tested. I want to know if there've been head injuries or if they've had COVID and now have long COVID, because we're also seeing a lot of ADHD symptoms attributed to long COVID. And then we dig into the symptoms themselves. And the gold standard for that is to use a structured diagnostic interview. So typically to assess ADHD symptoms, we use something called the DIVA, not just because it has a great name, but it is a really good structured interview that assesses all 18 possible symptoms of ADHD in the past 6 months, as well as during childhood. Like I said, this is neurodevelopmental. We want to see, even if it doesn't look the same, we want to see evidence across the lifespan. And it gives a ton of really good examples of how these symptoms might appear at different times in a person's life. So I find it's a really useful tool where somebody might initially say no to the symptom. Do you have trouble completing chores at home? And they'll be like, no, not at all. It's like, okay, do you ever forget to return something that you purchased and meant to return? And you kind of see the light bulb. And this is where I feel like maybe that lived experience can be extremely helpful in knowing what to ask because I know what things I struggle with. I know what things, I've done thousands of these assessments. I know what things tend to come up. And so we really look at that. We really assess for that. And so the DIVA does a really nice job of assessing for impairment. So there are 2 full pages, both for adulthood and childhood, where we are looking at the ways in which these symptoms are impairing the person currently or ways that impaired them during childhood. And it also allows for uh, a little bit of wiggle room. So, one thing that I have found in doing these assessments is that people with ADHD can be some of the most creative, brilliant sorts of people who come up with amazing ways to mask symptoms or to not let symptoms interfere. So, in the DIVA, it explicitly says things like they had limited impairment due to high IQ, limited impairment due to imposed external structure. And so it really allows us to look at the person's individual experience and determine if there is impairment. The other thing that we do is we give people normed rating scales. So these can be things like the bars, which is Russell Barkley's ADHD assessment. It could be the CARS, which is like the Conners adult assessment, the brief, anything like that that really addresses symptoms and allows us to look at them compared to other people diagnosed with ADHD as well as neurotypical people. And the other nice thing with those rating scales is they almost always come with a self-report as well as an observer report or an informant report. So another piece of the assessment that is really important is getting what we call collateral information. That can be asking for school records if they're still in school. It can be talking to people who know them well. We typically try to interview or send out rating forms to a parent, a best friend or a partner, somebody who has seen this person in different domains and might have a good sense of how these symptoms impact them and how they come up. And one thing that Dr. Sibley really emphasizes with these symptom rating scales is using what she calls the or rule as opposed to an and rule. And all that means is that if one person that we are giving this to endorses the symptom, we count it. We're not always great at seeing how things manifest in ourselves. Also, people with ADHD tend to mask their symptoms. So it may be that someone in their workplace might have no idea that this is going on because they've gotten really, really good at masking symptoms in the workplace, but that uses their entire executive functioning battery for the day. They get home and things fall apart. So using the or rule lets us really delve deeper into things that people see about themselves, but also things that other people see about them. The other reason this is important is that just symptom level disagreement is really common. We don't want to rule something out just based on the fact that one person didn't see it. And then we use a structured diagnostic interview for any sort of rule outs or comorbid diagnoses. And this is where those initial symptom rating scales or larger scales like the PAI, the Personality Assessment Inventory, really help narrow down what we want to further assess. But I'll use the SCID, the Structured Clinical Interview for DSM-5, or I'll use the Diamond. I do not know what that stands for, but it's free and available online if you Google the Diamond interview. And we use that for any sort of comorbidity or rule outs, because like I said, the symptom overlap is intense. So that's the assessment. They come in, they do these things. If they do not need accommodations, if they aren't applying for disability, if they're not doing something like that, we generally stop there. That gives us enough information to confidently say if a person does or does not meet criteria for ADHD.